always, to join. And I apologize in advance that if there's some technological issues, Callie, who I work often with and does this all the time, will take over. But we are going off of no power unexpectedly at our clinic with issues with Wi-Fi. So I'm sorry, that is on me. But it is so good to be here. We are excited. I am looking down and seeing that it is already mid-December, which is crazy to think that Christmas is 10 days away and New Year's is just, a few weeks away. So it's definitely a kind of weird world in the sense that things go fast and slow at the same time. But we will talk today about navigating that. I know a lot of you may be experiencing what we often call the holiday blues, or maybe you're kind of starting to understand and or struggling to deal with the stress and the anxiety that comes with this season. And we are here to talk about that today. We're going to talk about how to manage stress and anxiety during the holiday season, but we're also going to focus more importantly on self-care, which is a little bit different, right? There is managing stress and anxiety is one thing, but then there's also engagement in self-care and being intentional about it. So much more proactive versus managing stress and anxiety being reactive. And so we'll talk about both and hopefully be able to give you some skills today. I am so excited to introduce both of our panelists. But before we do so, a couple of updates. Please make sure throughout today's talk that you put any comments, questions, topics you want us to cover in the pane that you see right there on the right-hand side of your screen. And of course, you can always visit iocdf.org/peace of mind. This is where you will find out about all of our upcoming live streams, the different events we have going on, and also where you can put content questions that you want us to address. So please make sure to check it out. As always, this is not intended to replace therapy and is intended to be educational. If you are feeling unsafe or suicidal, this webinar and or the IOCDF is not a crisis hotline. We want you to go to your local emergency room, call 911, or call the suicide prevention line at 1-800-273-8255. So we're going to hop in, and I am excited. Again, say hi. Let us know where you're joining from. And really, more importantly, tell us what you want us to cover. What would be important to you, or questions that you have about self-care that you struggle with that we might be able to give some insight on. So I'm going to start with introducing my panelists. I'm going to start with Callie. So many of you know Callie. She's been on a couple of our webinars before. Callie is somebody who I look up to. She's an inspiration to myself and many in the OCD field. I've worked closely with Callie on and off through the years. She works here at McLean OCD Institute and is also a PhD student at Baylor University. Callie's research really focuses on competitive athletes with debilitating anxiety that negatively impact their performance. Callie won 9 conference championships at Rice University and was named an honorable mention All-American in the 10K. She was also able to reignite her love for her sport after receiving appropriate evidence-based care. And I hope that's something we'll talk a little bit today about. Is I want to know, Callie, if self-care, if your sport is now a part of self-care, and what it was like when it wasn't, and how kind of you knew the difference and you navigate that. So we'll hop into it. But Callie is an incredible clinician. She's an incredible student. She recently qualified for the U.S. Olympic Trials Marathon in 2020 and continues to pursue her passion while running. And really, Callie has been a light for individuals struggling with OCD and has particularly really taken a clinical interest in anxiety in athletes and really helping speak out and educate the entire athlete community on anxiety, OCD, and how we can encourage people to receive treatment and how that can actually make them better at their sport versus the notion that a lot of people have, which is that treatment will take away my good performance or me being good, right? Kind of similar to what we see in scrupulosity, that fear of, if I get treatment, is that going to make me less faithful? We're here to break that myth. So Callie, thank you for joining. We're so excited to have you. If you want to spend a second just kind of introducing yourself, or maybe even a little bit around why self-care is important to you and why you're excited that we're talking about this today.
Yeah, I am pumped for this talk. This is my absolute favorite thing to discuss, just because you hit it right on, Liz. I think that running for me used to kind of be a prison cell because there were so many compulsions that had to surround it. And so I just feel so empowered to be at this place in my life now where I can run and enjoy running. And it is an outlet for me, in addition to the ERP that I do. But it's just such a different perspective that I have on it now. So there's a lot of freedom in that. So I'm very excited to talk about it.
Well, we're excited and we will dive into all of those things because I have a lot of thoughts just based on those few comments. So I know a lot more will come up. So let's introduce our second panelist, Jacob Noda. Dr. Noda is a clinical psychologist in Massachusetts who works as a staff psychologist at McLean OCD Institute in Boston. So everyone, y'all know I'm here in Houston, but Jake is at McLean Boston and is the president of the Overbrook Counseling Center. Dr. Noda engages in a program of clinical and translational research focusing on the intersection between sleep, circadian rhythms, and anxiety disorders. He also provides individual treatment, supervises students, and conducts research at the OCDI. We are so excited to have you, Jake. And the thing that I love just kind of knowing some of your work is your ability to talk too a little bit about sometimes when we treat OCD, I find people unintentionally treating it in a capsule and we don't always talk about the whole picture, sleep and stress and all these other things that also impact not just our relationship with our anxiety disorders but our relationship with maybe self-care as well. And so I am excited to hear about this from both a research and clinical perspective. So thank you so much for joining us. Love to hear a little bit about why self-care is important to you and why this topic is something that you were excited to join.
Sure. Thanks, Liz. Yeah, I'm really excited to be here and join you all. And I think that introduction was great for setting up why I said this would be fun to be a part of. I do think part of my research on sleep and circadian rhythms in relation to OCD symptoms is driven by this idea that it isn't something that's separate from your body, separate from the rest of your life, or when it comes to circadian rhythms, like separate from being a part of being on the planet Earth, where there is a cycle to the day in, day out. So I think that self care, maybe people think of sleep as kind of often under that heading, oh, I got to get more sleep, or I got to sleep, on a good schedule and things like that as a self care effort. And I think there's something to paying attention to how that can make the work you do in ERP harder or easier, or um, engaging in the other parts of your life harder, easier while you're doing really difficult work in ERP. But I think too that it's something that also can be uh, yeah, like uh, a marker or a consequence too of if we're not taking care of ourselves. We might see it in, I'm not giving myself enough time to sleep, or I never have a schedule, I'm trying to do everything so perfectly, or I'm trying to feel just right before I finish the day out. That it's often something that when I hear someone's really feeling stuck, one of the things they might describe is how sleep has fallen off too. So from the sleep research and clinical work, lots to talk about. And personal life, I know I have to think a lot, especially as you said during this time was in the year where things are busy, about my own self care. So I was excited to hear what you guys were going to talk about and share strategies I'm using in my own life too. So
Absolutely. Well, we're excited for you to be here and excited to talk about this. And I love one of the things you just set up that I want us to talk a little bit about, which is, does self-care have to be perfect? And what I mean by that is I think two questions come up when I think about the OCD population. The first is oftentimes we feel like if we're struggling, how could we engage in self-care? How can, like, self-care, right? We even hear this with mindfulness, the thought that like mindfulness means I have to have zero thoughts and I have to feel like totally zen. And most people with OCD feel like I can't do that. Like that's not feasible. And so I'm just curious what the research, or from a clinical perspective, Jake, what your thoughts are on how, if we have the urge to feel like, not even the urge, but how, if someone feels like, hey, I'm struggling with severe OCD, how could I even think about self care? What, how can we shift that perspective, and what might self care look like?
yeah, that's an interesting way to start thinking about it. So I think that the um, things that I can say just in my clinical work, like in my private practice or at the OCD Institute in Boston, where we talked to a lot of people about sort of trying to put together a plan to do this, whether it's ERP or get to the point where maybe that would happen. Um, we do have to think a lot about, uh, what are you doing, not doing, how much value you're putting in getting something right, even if it's at the expense of maybe other things you really care about. But they keep getting kicked down the list. Like, I'm not going to exercise or sleep or spend time with my family, or lots of things. A lot of times the plan, it's as important, and I think a lot of times more important, to emphasize what are these things that we are going to kind of put back and say, want to not kick those down the list every day, or ignore those to the for the sake of getting something else perfect. Even if it was sleep, like I meet a lot of people at the OCD Institute where we come in, and I might get called in for a consultation because they maybe are on a totally reverse sleep schedule, or they have no sleep schedule. They feel like their sleep quality is really poor or something, so they'll meet with me, and they'll talk to me about it. I really want to get this perfect. I want to figure out, okay, so I'm supposed to fix my sleep. You're the sleep guy. How do I do this right? And we might talk about how important it's going to be to actually not trade off the time that you're getting to spend with your family, or the time that you're engaging in your sport or something that you really like doing, just for sleep, and have to accept that maybe that means sleep isn't going to be optimal at this time, and maybe it'll change over time, or not. Maybe your balance, there isn't some outcome. We all sleep the same way. The norm for most of us is that there's a lot of noise in the system, and everybody has different amounts of sleep they need, and everybody has to fit it into their lives. And so yeah, I think this idea of self-care, from the get-go, it's always on my mind, as it's not just something you do when you've got bandwidth. It's You're going to get more bandwidth from perhaps including that from the start, and putting it into relation with maybe hard work that you're doing that is important, like ERP or other things.
Absolutely,
So
right? It's
yeah.
this constant battle between things that are important to us, but letting
Yeah.
them stay important and valuable
Mhm.
versus trying to have them be perfect or trying to reach a level of perfection, which we know that's where the OCD rules of rigidity come in, right? Is like, if I do this, it has to be perfect. No, like that's actually not achievable. So Kelly, I've got a couple questions for you as well. Hi Dave, hi Sam, hi Nancy and Josh. Sorry, I moved back to the work computer because our power's back on, so that's nice, and I'm hopefully got a little bit better connection now. But please make sure if you guys have questions, you put them in the comment box along the way so that we can make sure we answer them. But Callie, one of the things I was thinking about is how awesome it is that for you along your journey, right, running and your sport was something that at first or at some point, right, you loved and enjoyed, but OCD probably took away a lot of that pleasure. And I want to hear a little bit about that, to where, from what I know from you and your story, right, is that there was a point where OCD kind of took away the enjoyment and freedom in it. And it became this like, I have like these rules and rigidity, in which now the pleasure is gone from the sport because now OCD has taken over. But what I also know is how much you've shifted, and how now running is something that brings you joy and brings you pleasure. And I can see it actually. Like I can see when you post or when you write, like just the difference, and it feels like it's freedom, right? And I want to hear about that. And then I want to push a lot of our viewers that can happen with some of your OCD as well, even though some of you might say, well, none of my rituals could ever be enjoyable. I'm gonna push that in a second. But I want to hear from Callie first on what that experience was like when something you loved became capitalized by OCD, but how'd you get it back?
Yeah. So when I first started running, I still remember that OCD hadn't latched onto that as much yet. It was still around like from third grade until maybe my sophomore year of high school. That was around the time I started getting more successful with my running. A lot of my OCD was triggered around doing the right thing, or making an A on an exam, and making sure that I didn't cheat, because I was always worried I'd look at someone's paper and then tell on myself. And so it was just all around like other things that had value in my life. And so as I got to my sophomore year of high school, there was a lot of talk about college running and how that could be an option for me if I continued on the path that I was on. And so there was just this weighted pressure that started building. And I started to realize that I couldn't tolerate the uncertainty of lining up at a race and not knowing if I was going to win or not, despite what people might say. And so I would stress myself out and then get to a place where I was doing all these compulsions because I could handle the uncertainty that came with that, right? So I could tie my shoes over and over again. I could ask for reassurance. A lot of scrupulosity and sexual intrusive thoughts would come up around races for me. And so it was just all this back and forth rituals that 2 weeks before a race, I knew that, and I would even tell my teammates, I'm not going to be myself this next 2 weeks. So just bear with me. And once the race is over, we can go back to having fun. And it should never be like that for anyone, whether you're in high school, a professional athlete, just beginning sport. And so at that point, I just thought and kind of accepted this is how it's supposed to be for me. Like, I'm just going to suffer around big races. And it got pretty hard towards the end of high school, especially right before I committed to the college that I went to. But in college, it got even worse, right? Because you're running for a team, and that is basically your career at the time. And so there's a lot of added pressure, no matter how great of a coach I had, because I did have a phenomenal coach that had some understanding of OCD. But it just became this, like I said earlier, prison cell. So I would just not look forward to racing at all. I loved to train, and even talking to my coach, he would say, "Are you so excited for this race?" And I would say yes, but in the back of my mind, I kind of didn't have as much of a perspective for people that didn't have OCD at the time, because I was still young in that. And so I was like, how could anyone be excited for a race? This is the most miserable thing in the world. And so I couldn't see it at that time. And even now, I still find myself being protective of balance. I would say, I guess is the best way to put it. So like if there's a distance runner that says, yes, I eat, sleep, and breathe running, I love that so much, I know that that's not healthy for me. I know that that crosses the line to putting too much pressure on myself. And it doesn't mean that that's wrong, that that person is really passionate about running. But to me, I know that I can't be that way. And so for me now, it is like, yes, I'm going to run, but I'm also going to put a lot of effort into my career and into education, because the balance is self-care for me. And so that when it comes to running, it's still something that's fun, because I even tell this to patients that are in athletics. I will say, you are good at your sport, and that is wired in you, and your ability to try hard and do a good job isn't going to go away. So if we can take some of that pressure off and take this a little bit less seriously, you will show up. And so I'm constantly telling that same thing to myself before races, and it's taken so much of the pressure off. And little by little, it's not perfect yet. I'm still working on it every day, but the love is coming back.
Can't unmute myself or speak without it. But the reality is, right, Callie, is like, we're actually not searching for perfection, right? So we're searching for there to be flaws in it and for you to keep working on it. And so some of y'all might say to me, well, Liz, like, what ritual could you possibly tell me could also be self-care besides something like a sport, right? You could see that. What about a shower, right? For people with contamination OCD, where showering is this like required thing we have to do, but it's exhausting and it is trying, and it's something we could never imagine, right? I can tell you that I have zero OCD left when I shower, but showering now might still take me 20 or 30 minutes sometimes, which might not be right. It could take me 5 if I wanted it to, but it's not because I'm stuck ritualizing. It might be because I have a 7-month-old, and it means like I get my peace and quiet to just sit there without any noise in background, but I'm enjoying the warm water, or I'm taking my time washing my hair, right? But that can become, right, that's where we can see, like, for many people with OCD, maybe you haven't taken a bath in 10 years because you felt like it was really dirty, but now all of a sudden you can take a bath in the evening and it's your way of relaxing. That is where, like, self-care, OCD does directly impact self-care, but we can get it back. Right? We can make these things that are exhausting and trying and difficult be enjoyable again, or be something, maybe it's not even enjoyable, but we're grateful for it, right? Somebody with hit and run OCD might not like driving and spending time in the car, but for maybe they enjoy podcasts, and now they can like enjoy a podcast while they're in the car and find that like it's a pleasurable experience, where before OCD would not have allowed any sort of freedom because they're too focused on the road if they have hit and run OCD, right?
I would
Callie?
say I would take that even with us now on this journey. Like, we can feel that self-care even more because of how far we were the other way, right? So like, for me, running was so terrible. And now to be able to go on a run and enjoy it, there's also this sense of empowerment that I get with it. And so it's like self-care times 10.
Totally. I was just speaking about this with a patient. We were talking about how, right, sometimes those little activities of daily living that people without OCD just take for granted because it's the norm. When people with OCD can engage in those without OCD rules and rigidity and OCD like controlling it, we have so much like appreciation for this little thing, like a hand wash or whatever it might be, right? Because now like I can literally wash my hands sometimes and sit there and feel the warm water, and it can be just kind of this mundane experience, right? But it's not controlled by OCD anymore, and that's so different, right? That's where we can. And so, Jake, one of the things I want us to talk about when we think of self-care is, I know for me, years ago, my understanding of self-care was like I needed to spend 5 hours at a spa in bliss, right? And what I learned is like, it's not usually realistic with our schedule or our finances, but also like that's not feasible for most of us often, right? Or all the time. And so how quick can we reach, in the sense that like, can 5 minutes be sufficient for self-care in a day? What should people's expectations be? Where do they start? What could it even look like if you're like, I have no idea what self-care even looks like for me and I don't know where to start or what to try?
I think that's a really good question, in that it sets up a couple things that I've learned myself about self-care, going through graduate training and internships. And then, yeah, I have a 18-month-old son, so reformatting my life around that in the last year and a half during the pandemic. I think that there's a few things that I really have seen in the research and experienced myself that stand out about what self-care means. I think the first thing that I've really picked up on, and I talk to people a lot about at the OCD Institute and my private practice, is self-care is not um, the same for everybody. Like a 5 hour trip to the spa, I would love that. That would sound amazing. But some people may really not like that. Like that might not be their self care. Or like you said, there may not be, like, that's not an accessible thing. If I define self care as, people who get to go to spas, then many people are not going to be able to do any self care. But I talk to people about, sort of almost like when you do a value card sort, if anyone's ever done that, where you kind of lay out, here are a bunch of things that people could value. Do I actually value these? And if I had to kind of put them into a sorting of, these are really important and these are not, that I talk to people about that. I have a patient who, her self-care thing that she's really emphasized doing recently has been being part of a chorus, and she loves singing. She used to do it more. She stopped doing it more when she had kids and work, and then she got back into it. And it was really important to her. Other people's self-care might be, I need unstructured alone time, to do my own thing. Um, for me, I have played music for my whole life, and I recently was like, I'm gonna make a commitment to like one night a week where I go play music outside of my house, where I don't have to worry about bothering my kid and my wife. And um, so I think part of it is, yeah, starting with, you know surveying and looking for, are there any places where I know this does feel like it refills the tank for me, or gives me more bandwidth or resources back, and am I doing that? I think the second step then would be, am I doing that at all? Or where am I doing it? And if I'm doing it a ton, can I give myself credit for that? Or if I'm not, uh, is it okay to increase it at all? Like, I think 5 minutes of self-care is totally possible. Mindfulness is a great example of that. You can find mindfulness scripts and meditation and stuff that are 30 minutes long, but I personally can say I cannot, I will not always experience that as this is self-care. It's almost like that would be a long practice in mindfulness, and doing it for a couple minutes could make a big difference. Or doing some diaphragmatic breathing for a few minutes between a meeting, or while I go to the bathroom, or whatever, um, is certainly something that I think is worthwhile, and adds in this layer of, if you're gonna be coming up with a plan that's sustainable, then you should be asking questions about, how do you keep giving yourself something back to do the hard stuff that you have to do too, whether that's get through um, a time where your OCD is going to be louder and more bossy, or if it's doing your hard ERP that day, or if it's just going to work and having to do everything else.
Yeah.
That. Um,
And
so
for
I think
some
it's
of us,
definitely
right,
possible.
it's also knowing like, what do I need, right? So I'm somebody,
Mhm.
Callie knows, she's worked with me for a long time, but like I struggle to disengage from work, right? That's it's hard for me, and I also don't find work to be something that really burns me out. I enjoy it, and so I like to stay connected, but sometimes I need a breather, right? But I know, so if I'm on call, like of course I can't have a breather because I need to have my phone with me, but like for me, I have to like leave my phone and go take an hour or go do something to truly disconnect, because I know my pool, right? If the phone's there and the email comes through, I'm going to check it. And it, again, it's not necessarily really draining, but sometimes I don't even know I needed that break until I require myself to take it, right? And there's a question from Josh Jess that we'll get to at 12:18. It says, first of all, thanks so much. I have several patients who can really have a great experience, but can we talk a little bit about setting boundaries as self-care? And I love this question because I think this is so important. And I hear this all the time with patients with OCD, where we struggle with assertiveness. We struggle sometimes because of maybe also anxiety or different things, but are we going to let someone down? Are we going to disappoint them? But we struggle sometimes to put ourselves and some of our needs above other people's. And to me, that's one of the biggest lessons from self-care too. And one of the biggest, like the most important things we can work on. And so any tips and tools, like Callie, what do you tell? I know you work a lot with kids and adolescents. We'll start there and then Jake will go to adults. But when they're saying like, yeah, like my friend always wants me to go do this, and with this friend, it's actually triggering or whatever, and I need a break. Like, how do you encourage them to set those boundaries? And what are some ways we can start to think about doing it?
Yeah, I want to start with, I think we hear self-care and our automatic thought is like, oh, I have to enjoy this or I'm not doing self-care right. But like self-care is oftentimes an exposure, especially for us with OCD, right? And so an exposure of setting a boundary when you're not an assertive person, especially for kiddos, I would always tell them, okay, but what's our end result, right? Because in the moment, the kids can't see, okay, me setting this boundary is just going to be uncomfortable. Why would I do that? But like, what's our end result? And I often find that they resonate with future goals that they have. So like if it's a adolescent that eventually wants to go to college, they're going to resonate a lot more with setting a boundary with an individual that wants them to play a sport that they don't want to play, than if I tell them, hey, but you're going to get these things come up at you in college all the time when you're trying to figure out a career. If you agree to all of those, where do you think you'll be in the future? Versus like, hey, let's work on this now so that when you get to college, you can decide this is what I want to do all on your own, and you'll have the appropriate boundaries then. And so just letting them know this is a tool that they're going to use as they continue to grow, I think is kind of the best approach to take, because
Yeah,
that
and
motivation.
I love it, because what I think about too, and we ask people this all the time, is what are some things, if you didn't have OCD, you'd be doing, right? What are some things that OCD has taken away from you? And oftentimes those things are self-care in and of itself, right? Whether it's playing music again, whether it's, engaging in a sport, whether it's going to dinner with friends and being able, right? Going to dinner with friends, if that's something you used to love, but contamination, OCD is targeted eating and you're not eating out, like that's not going to feel like self-care if you haven't addressed your OCD. But once you do, right, that can be a goal. So sometimes self-care is also goals that we're working towards so that those experiences or situations can become enjoyable again, right? Like I promise, when Callie started to disengage OCD from running, it didn't overnight make running be this good free experience free of OCD. It takes time, it takes practice.
Right. Well, and even so one more thing I wanted to speak to is even to this day, I'm still doing running exposures, right? Because we're not ever going to reach perfectionism. So last week I had a stomach bug, it wiped me out for 3 days and I wasn't able to run. And old Callie, pre-OCD treatment, would have said, this is horrible, I'm getting behind. And I would do all these compulsions to help relieve the anxiety. It was still very hard for me to rest and take these 3 days off that I needed to take off. Because I was like tracking in my head, I'm getting behind, but I had to constantly remind myself, okay, but that's your anxiety saying that you need to run. That's not you, and want to rest because I felt horrible. And so it's just that matter of what's speaking. I tell this to my kiddos a lot too. Are you speaking or is OCD speaking?
I love that. Yeah, I love that. That's so important, right? Who is speaking and who's making this decision? Is it you or OCD? Because the more we make decisions, the more we're making them for us, right? And any small decisions can become self-care. Jake, what do you think for adults? What are one of the big things that you see as being like a barrier to boundary setting when it comes to taking care of ourselves?
You totally took the words straight from my mouth about the idea of who's speaking and self-care. The way I was thinking about it, it's not really a great shorthand for it, but it's like, part of this is, it's really about self, right? It's like, who am I versus what am I doing to alleviate what OCD says I have to do, or this thing that I can't have happen, or this feeling I'm not supposed to have, or whatever. So yeah, I think that idea of self-care comes back to asking, is this you? Would you do this? Would you like to do this? Is this part of your life? Um, and then sometimes what that looks like is doing things that do feel really immediately reinforcing, but other times it's doing something hard, right? Like I'm going to go see my friend anyway, and figure out a way to be with them because that's important to me, even if the eating part of it would be hard. I think those are really great examples. The other thought I had that I've talked with people about, sometimes put it this way, but not always in this exact uh, sort of comparison. But for people who maybe have been exposed to the idea of like distress tolerance skills, I think sometimes self-care can kind of feel like it falls under that heading, right? Like I'm going to do this nice thing for myself, this sensory experience that'll feel relaxing or calming, but um, not all distress tolerance skills are about taking it down from a 11 to a 7, on a SUD scale that goes to 10. Sometimes those are the kinds of skills, but sometimes distress tolerance skills are more about how am I going to keep going when it's a 7, right? Or how am I going to go when it's a 5 and not,
Yep.
escape and miss out on something I really care about. So I think here too, it's like doing in ERP could be self-care, and like Callie was kind of saying, that does feel like there's a meaningfulness to kind of going with that, and maybe there's something reinforcing about knowing that and giving yourself credit for that. And I think in adults, we often have the advantage in a lot of situations where people like just have more autonomy than kids, right? Like you have choice about how you spend your time. I mean, of course you have boundaries, people have things they have to be at and things they have to do, but I often talk to people about leaning into the, like, you're in charge of your life. OCD is trying to tell you you're not, but you could decide this is an important enough thing to do. I just had a patient of mine who I've seen for years who's kind of balancing. He just got a full-time job. He's really excited about that, but he hasn't worked full-time for a long time. And so there's a lot of anxiety about, like, will I be able to manage my, he has like physical symptoms that come up when he's like out doing certain things related to his job. He's like, will I be able to manage that? I'm kind of worried. I kind of almost want to just focus on getting ready to start my job, but it's Thanksgiving and the holidays, and visiting his family would be very meaningful to him too. And we talked about, like, yeah, this is your choice. Like, they aren't fully opposed to each other. You could decide it's a very important self-care thing for you to go see your family. He did that for Thanksgiving, and the OCD told him the whole time before he got there and while he was going, this is a mistake. You're going to blow your job. You're going to ruin this. And then he went and came back and was like, I'm really glad I did that. That felt super meaningful to me. And yeah, am I, feeling more of the physical symptoms because I traveled and all that stuff? Sure, but I wouldn't have traded it. I'm ready to keep going. I actually feel more invigorated to work on my job. So I think I lean into that. Like, like you guys were saying, same thing. Like, who's speaking here? Whose life is this? Make those decisions. Who is the self in this self-care?
Yeah. I love that. And I would push, because we hear this a lot with OCD, but this need for like, well, I can't go do that pleasurable activity until I've done all my rituals, right? Sometimes OCD kind of latches on to, I can only have this enjoyable experience if things are perfect. And we can find, actually, you could find self-care becoming triggering in and of itself, because there could be this thought of like, well, self-care has to be perfect, or I have to be feeling really good to engage in self-care. And I want to talk about that even from a depression stance, right? I think that we talk about this all the time, but if I'm feeling kind of down and depressed, or even just exhausted, maybe mentally and physically, and sometimes I need to listen to my body, but sometimes I know staying in bed is more of a depression choice than another choice, right? I don't want to go to the gym or go on a walk or do things that sometimes might be self-care because I don't feel like it, right? I don't feel good. And sometimes we have this thought of, well, I need to feel good to go do that activity, right? Or I'll go work out or go to the gym, or I'll go do that Pilates class that I enjoy when I'm feeling better. But the reality and what we know is that most of the time, even if we feel bad when we start, by the time we begin engaging in that activity, while we may not feel great the whole time and we may still be experiencing some anxiety, depression, intrusive thoughts, whatever, we might also experience some joy or freedom during that experience. And I want you to think about that. I want you to think about self-care in a similar way that you think about OCD treatment or engaging in, right, living by our values. I don't want anyone to hear me saying, what, if you have OCD, you need to accept that forever. If you want to live by your values, you have to learn to just live by your values while feeling like crap, right? That's not the message I want to send. Our goal is that you can fully engage in values-based living without any sort of suffering, any sort of pain, any sort of triggers. But what we're also saying is that we can feel uncomfortable and still choose to engage in valuable things and still choose to do things that are important. And what we might even find that I'll push is that while doing those valuable things, we actually might find that there's some enjoyment in it too, right? Oftentimes we think, well, no, we're triggered. There's no way we won't enjoy any of that. Why would I go? And then we go there and yeah, maybe we were still triggered, but we enjoyed some of it and we can be surprised, right? So sometimes self-care can surprise you.
Yeah,
Go ahead.
Sorry, I was just gonna say, sometimes I think it happens too, where you take the risk and you do the really exciting thing that you knew was going to cause anxiety, and you get triggered. And it happens all the time where we end up beating ourselves up for, well, why did I take that risk? Why did I do that? Now I'm miserable and I shouldn't have done that. But I think the reminder to give yourself is, okay, but you just did an amazing thing, right? You just did this exposure that you've been putting off, that you didn't feel maybe you were brave enough to do. And the thing that I give myself all the time, it's like this gracious piece of advice reminder is, if it wasn't that, it would have been something else. So you didn't actually cause more harm. You did a really good thing. And I think our natural inclination is to just beat ourselves up for something great that we did by leaning in and doing the exposure anyways.
Exactly. Right. And self-care is similar, right? It doesn't have to be, we're not searching for perfection. We're searching for trying. And sometimes, I always think about this with even like deep breathing exercises, is people will say they might practice some of these things. And they're going to use deep breathing when they're feeling distressed. And they'll say, well, Liz, I tried it when I was distressed and it didn't work. And I'm like, okay, well, the first time I have you practicing a skill, I actually want you to practice it when you're calm, right? Practice self-care and know that it's going to be a process, not perfection. It might take you 15 tries at different things of self-care before you find the thing that actually works for you. And what Jake said earlier that I love is it filling you up? Are there things that you do that afterwards kind of refill you and reset you versus only things that exhaust us, right? We can't get rid of the exhausting things completely. I mean, we would all love to, but that's a part of life, whether you've got a baby or whether you've got work or whether you've got school, right? Like there's things that we love about it and things that are hard about it too. And so we're not going to expect perfection across the board, that everything's enjoyable, everything is self-care, everything is fun. But can we find some things that fill us up that can help rebalance us or can help recenter us? I love all the comments that have come in, and loving hearing that some of you are saying this is really important and crucial. I want to hop into one of Patricia made a comment at 12:31 that says, do you think temperament plays a big part in being able to keep up with a plan of self-care and recovery? My son writes a plan or talks about his plan and does it for a day, sometimes 2 at the max, and then he's back to OCD routine. He's a young adult, 24. And Patricia, before we answer it, I'll kind of caveat that this may be 2 questions, in the sense that you may also, I'm not sure if you're talking about a self-care plan or a plan for OCD and for OCD kind of rituals and treatment. And so maybe we can kind of speak to both. So Callie, why don't you start with speaking about it from OCD perspective. So if someone sets an OCD plan, they do really good for a couple days and then they're back doing OCD rituals. How do they reset? How do family members, like the bigger question here is, how does a mom support their loved one if that's happening?
Yeah, I think, again, motivators is a really important key here. So reminding themselves often of why they're doing the hard work that they're doing. And I always use the example of hit and run OCD. Like if someone goes 3 days and they do excellent with their exposure work of not going back and checking, but that 4th day they check, it's not necessarily that they need to, again, beat themselves up for, well, darn, I went back and checked, but instead let's plan ahead. Okay, that's fine. We have this extra data now to be able to say, okay, like I went back and checked. And so next time I'm going to hit a bump and I'm going to get triggered a little bit more probably because of this check that I just did. So what am I going to do ahead of time? So kind of preparing a plan for, we know what our triggers are at that point in treatment. So just a plan for, okay, I know this trigger is going to come up. So what am I going to do instead? That preventative measure can help your son, Patricia, kind of get back into a place of, I already know what I'm going to do when this comes up. So I'm not going to go back and into that old slippery slope of a routine. But then also having accountability, I think, is a huge help. Even if we already know all the ERP exposures that we're supposed to do, especially if we've been in treatment for a while, I still go to my own therapist because I need that accountability to be able to have someone to check in with and say, yes, I did my exposure homework, because otherwise I would avoid it and push it in a corner and not touch it. And so just having that therapist ask, because a lot of us with OCD are people pleasers. So that tends to be a very helpful tool.
Absolutely. And so, Jake, if we're talking about self-care here, that there's a self-care plan, and we find that almost OCD actually interrupts the ability to engage in it a couple days in, what advice do we give? What feedback?
Yeah, well, I think bridging probably from what Callie said, that I always am thinking about and watching out for, and I see all the time, all or nothingness. So even with a plan, like I could think this is a great plan, but I didn't do it today or whatever, so I'm not doing that plan anymore. I think sometimes that's a thing I would watch out for, that kind of bridges across like doing treatment and doing self-care, that we can get into. If I didn't do it this day, then it's kind of like it's ruined, or I'm off it or something. So I would ask a person, like, what's it feel like when you don't do your self-care that day, and what are you saying to yourself in your head? And if it was all or nothing, I might try to address some of that. But I think similar to what Callie's saying, I think too, I talk to people about really you know having to kind of think about where are you with self-care stuff, like, and that's why if we're taking this kind of survey approach of thinking about what are your self-care places that you're already doing things, sometimes it can be more, I know I actually did keep showering and eating and doing, like, and those are self-care things. Like if you don't do that, it's going to empty the bucket more. I didn't sleep, or I went to sleep and I did that. If those things are there and not wavering as much, it might be like, oh, well, should our plan move closer back towards those? And, can we expand on, usually you scarf down your lunch. I'm a victim of this all the time. I don't have lunch with me today. It's that time in Boston. Uh, can I bring a lunch and spend 10 minutes eating it, not just eat it while I'm writing a note or do something like that? Could be a version of self-care for me that's better than I'm going to build an hour for going to lunch every day, when I know, like, I might do that a couple days, but I probably will have trouble doing it over and over. So sometimes it's that, to go that way. And then I think sometimes, you know, again, like if there is something, so what did you do instead? What started happening that interrupted your going to bed or your getting outside and going for the walk or whatever, to understand, something won out. There was a competition and what felt more reinforcing in that moment, and this lost. So like you were saying, Callie, with motivators, can we make that more reinforced? Can we, build up why that's more likely to be chosen in those moments? Can we decrease the value of the other thing in any way? Those would be things that I would think about. And as you were saying, also absolutely thinking this is never a linear, like you made a great plan and so you did it every day and then you added and it kept going. It's always kind of doing it some, doing it not. And then I really do value this, so I think it's easy to communicate. But I think if people can connect to this, you need those opportunities of it didn't work to learn more about, so what are you going to do the next time that happens? I'm not disappointed. I don't go, oh, well, that was a bad plan or you did a bad job. It's cool. We need data to be variable so we can see what's driving it, and then you can learn and iterate on it and make it better. And so it's a very classic CBT thing to be like, that's great, because it is always great. I want the information. Like, that's great that happened. Let's talk about what went on.
Yeah, I love it. That's always my thought. Even when we do rituals, right? It's we didn't succeed or fail at our homework, right? It's information about what we probably need to be focusing on and what we need to work more on. And Callie, I know you wanted to add to that, and then I'll get to our last couple.
One bullet point to add to that too is being honest with yourself, I think, is a really hard thing to do. Liz, we've talked about this before. Like, I know you have told me, well, it's kind of like my worst nightmare to sit on a beach and just relax, right? And I think that that's great. And you know that about yourself, because it's similar to me as like, do you prefer mountains and skiing, or do you prefer sitting on a beach and relaxing, right? And for me, what I have to tell myself and keep in check with is, one of my very common exposures to do right now is to sit in silence, or to just like cook. If I'm cooking in the kitchen, I usually am listening to a podcast or talking on the phone or doing something else, but just to cook, because those are things that are really hard for me. And so I have to be honest with myself, because it would be very easy to say, oh yeah, I don't like sitting on the beach and relaxing either. But for me, that choice isn't a snow or a beach choice. It's no, I just have a really hard time sitting and relaxing. And I used to love the beach before OCD got to being a bad place. And so this is more of like a value that I have to stick true to, because I should continue to do exposures to where I can get back to enjoying the beach and relaxing. Does that mean that I'm going to sit in the sun the whole time? No, I'm probably going to play beach volleyball and swim in the ocean and be active, because that's just the person I am, and I accept that, and that's not an avoidance factor. But I like how we've said throughout this whole talk, you have to know yourself.
Yeah. And I will say, I think COVID was really eye-opening for me, just because I am somebody who always worked all the time and then would do events at night. And I basically was never at home. I was either at an event or at a restaurant or something. I rarely would be at home. And people who know me know, like, oh, you're not a homebody. But what they actually also know, people who really know me, is that I have a fear of being a homebody, because for me, if I'm home and I'm silent, OCD is louder, right? Intrusive thoughts may be more present. And so what I had to learn is, okay, I can start to enjoy being home and start to push myself and do exposures, or I can continue making excuses for it. Does that mean I love to sit at home all the time and I always will, even when I have no OCD present? No, probably not, right? I am an active person. I like to go and explore and things like that. But I don't want to not be able to be at home because of OCD, right? And for me, can I now, which now I can engage in an hour or two of self-care in the evenings at my home by myself, which I never would have been able to do previously, right? But now I'm so grateful for that, because when my daughter goes to bed at 7, I can't leave my house, right? I have to be there. But can I find enjoyment in that quiet time versus feeling, oh, I'm trapped and now OCD is going to be here, and that becomes something that's actually scary and anxiety provoking for me, and something I would be anxious about coming up or having upcoming. So yeah, that's important for sure. So a couple things, and then we'll move on. I see the last 2 questions that I want to make sure we get to. First is, how long, and I love this, how long can it take, it was from Sage at 12:41, sorry, the timing's always different, but how long can it take to get back to a self-care routine after being a long-term caregiver of a parent with burnout? Or are there resources that you can help suggest that might be helpful? Thoughts on this, Callie?
Let's see. I think it's hard when you get out of the routine, right? And so it's going to take some time to ease back into having a full routine. So just like we would with a exposure hierarchy, my thought is to just kind of take it a step at a time. Like we were saying earlier, just can you set aside 10 minutes, 3 days a week to do something that you used to enjoy before all that time was taken to being a caregiver? And so ease into something that you enjoy a little bit at a time. Don't expect yourself to just, okay, now I've got to start setting aside 3 hours every day to engage in self-care.
Yeah, that's right? It can be short, it can be goal-driven, right? But again, it's about anything. What's one thing you can do that you haven't been able to do for a while, whether it's listening to a favorite song and dancing freely for, 10 minutes, or right, what is it? But what are those things? And don't expect perfection overnight. Jake, I'll throw the last question at you from Majo at 12:45. Does chronic childhood illness predispose to OCD and other mental illnesses later in life? And sorry if I'm throwing a tough one at you.
No. Well, I'm going to make an assumption that illness means some kind of physical, like illness.
Medical illness, sure.
Yeah. So I think there are certain associations for people like between physical illness and OCD, like PANS or PANDAS. Like there are things like that there's some research about. As far as if you think of it backwards, like number of people who have OCD too, they had a lot of childhood illness, and that seems to be this link that would lead there. I think there's not as much, like a lot more people have OCD who did not have a ton of chronic childhood illness. I don't know as much about the direction of kids with childhood illness going to OCD. I think it's probably not super one-to-one kind of connection. Probably a lot of kids who are ill do not end up having OCD. I think generally what we'd say is, or what I would understand is that there's some component of the things you're getting from a hereditary source. So not necessarily even just genes, but things that you get have to kind of be there. And then lots of things can kind of lead to activating or like kind of turning on the possibility of OCD kind of coming to fruition or whatever. But illness maybe just could be one for some cases, and it's not necessarily everybody has that, or if you have that, you definitely will have OCD or something.
Yeah, and I would say, right, I would probably push that less likely that childhood illness would predispose you to OCD, but maybe the illness could onset the OCD, right? In the sense that,
Yes,
as
right,
Jake was saying, that might be the trigger, right? But what we actually know is OCD is neurobiological. So people with
right.
OCD, we're born with OCD. We don't, right? The predisposition already happened. Like that's part of it's no one's fault. Our parents didn't do this to us. It's not our environment. But sometimes maybe the environment, other things could be what triggers it or could be what onsets it. So last question that I want to answer, and I'll quickly answer, and then we'll hop off. Of course, thanks, Chris. We love you and love your comments. It's so good to see you. But at 11:53, do imaginal exposures really work? Because that's not real, so that does not give a significant amount of anxiety. The answer to this is absolutely, if done correctly. Right. So what I want to push is if you're doing an imaginal exposure, but you are reminding yourself that it's fake, then we're not really fully doing the imaginal exposure, right? The point of exposures is not that we do them to confirm or deny if something's going to happen. It's not that we do an exposure, right? We do exposures and we truly accept the uncertainty in them. Right. You don't do a contamination exposure and then wait and see if you got sick. You do a contamination exposure and you accept the fact that, yeah, you may or may not have gotten an illness and maybe you'll find out, maybe you won't one day. Right. We're not trying to prove. And so with imaginal, a lot of times we will get in this mind frame of like, oh, but it's not real, or this is, and we hear this all the time in our kind of residential setting. I'm sure, Jake, you do as well in Boston, but how can y'all mimic my home environment? Right. I have these triggers, but they're more situational. They're more at home or they're more around my work or my family. How are you going to trigger those, or how am I going to work on those in Houston? And the reality is that OCD is kind of wherever we are, and it will follow, right? It will come up even if it shifts. But it's about the concepts of treatment more than the specific exposures themselves. And that's something new. And I push that. And I've been talking a little bit about that. And at the next lunch and learn I'm doing will be Chris and his family, which will be awesome before the holidays. But you guys are going to hear about kind of the new curriculum for the webinars that we're going to be launching starting in January. And Chris and I, Chris Tronzen, who's an amazing clinician out in California, Chris and I will be co-sharing on Wednesdays, where it's really going to be about asking the experts. And we're going to be doing more of like clinical conversations and talking more about treatment and treatment interventions. And what I'm really starting to push is that it's less about your current OCD symptoms we're addressing. It's less about the specific exposures you're doing for your struggle, and much more about the concept of treatment, about uncertainty, about the model. Are you bought in? Are you willing to get to buy in? Are you willing to try? And are you willing to accept that? And if you are, whether we're doing imaginal exposures, in vivo exposures, we're exaggerating them or not, right? The treatment works. But it's not really that much actually about that specific exposure or fear. It's about the model and the concept. Now, we will target specific exposures, right? We will target specific fears. But the reality is that when we hear people say things like OCD feels like a game of whack-a-mole, where I'm constantly like, I address one symptom and a new symptom comes up. For me, what that tells me is that we're actually we're doing ERP targeted at your symptoms. And I want to do ERP targeted at your whole disorder. Right. And when we do that, even though we're going to target those, I'll talk more about it in January. So if it's confusing you, I'm sorry. But even though we may target specific symptoms, the goal is freedom from the illness overall. And what that means is that you learn and you buy in and you understand the model and the tools to be able to use them for the rest of your life, not only for specific symptoms when they come up. So we will talk more about that. The takeaways from today: self-care doesn't have to be a 4-hour outing or experience. Self-care is a work in progress. None of us are perfect at it, and none of us are going to become perfect overnight. And self-care is about you. It's about what you need and what fills your tank. What Jake does, what I do, what Callie does are all drastically different in the ways that it refills us. And sometimes even the things that feel like they should be self-care, spending time with friends or family, might actually be draining, because maybe for us, self-care is reading a book and not being around other people. And so think and spend a lot of time about what refills you and how can you make a commitment to start engaging in some of those activities, even if OCD or depression tell you shouldn't or tell you they're not going to be enjoyable. Give it a try and start pushing it. Thank y'all so much. I will let both Jake and Callie say any final words and goodbye. But as always, I am honored to be able to spend this hour with both of you and with all of you who are attending and watching this from afar across the globe. And we more than anything appreciate the time that you're giving us. Jake.
I agree with everything Liz said. I think this is awesome. Thanks for having me, and I wish you all the best.
Yeah, my final takeaways are beautiful questions, everyone. Loved having you all involved in it. And Christmas can be stressful with holidays and families. So do what you need to step away if you need some time alone, or be present.
Yeah, we didn't even get to holidays. So thank you, Callie, for bringing that up, because that's so important, right? The takeaway there is listen to yourself and listen to your needs. And while boundaries are hard, it's always easier if we set them up front and we're proactive than if we have to set them retroactively, right? If my sister asked me to help host Christmas and Christmas Eve, and it's going to be a lot on me to do both, it's going to be so much easier for me to tell her now, hey, as much as I'd love to help, I can only commit to one. Which one should I commit to? Versus me backing out the day of because I can't do both, right? And her, like, the ability for someone to understand that. So that's number one. Number two, think about what you need and stand up for yourself. If we're not taking care of ourselves, we can't take care of and or be there appropriately for others. So we all know that, and it is so true. As always, thank you guys. Help and hope are always available. See you in a couple weeks.